Hello, my name is Erwin Castro. I'm a nurse consultant for diabetes.
Central London OSCE or London Hospital OSCE. You decide. Our Central London purpose-built NMC OSCE course and practice rooms include all of the equipment you need to practice for your NMC OSCE exam. You get the same expert team by your side, the same expertly prepared materials, and now a dedicated space built just for our international and return to practice nurses. Learn more at www.oscenurses.com.
Hello, Manong George here. Welcome to our channel. And today we have a very special guest.
I've been in this role for almost 5 years now. Before that, I was a diabetes specialist nurse for more than 10 years. I've been in this country for a long time, since 2001. Yes, I met my wife in the UK, so we got married a year or two later. So, and she's also a Filipino nurse. She works in outpatient.
Manong knows best.
It's one of the best pathway because being a nurse consultant in a particular area, you have to really specialize in that area for a long time. So experience is key. What is very important as well is education and training. You need to make sure that you have a master's in the subject or similar subjects uh, regarding your specialism. So you have to study and study and study and read and read and read again because everything is changing. So there's a lot of development, in not just in diabetes, but in all specialism, I bet. So if you want to remain relevant, then you need to make sure that you study. Academically, you have to do your master's level education, as I said. You can pursue a doctoral as well if you're inclined, but I think we're working full time. Doing doctoral is really not very easy, is it? But doing a master's is essential. So yeah, so you have to study and read always.
Manong knows best.
It's as an 8B or an 8C post. So it depends which area in the country you're working. In London, in particular, some of the consultant nurses are 8Cs because we have a strategic role as well. It's not just clinical and management. You have strategic role. So if there's any development across your area, for example, you have to be heavily involved in that. So you're attending meetings after meetings as well with the integrated care boards now, which used to be the CCGs, and you have to make sure that your business hat is on as
The respected businessman with
well. So it's not just clinical. It's a big task, but it's an 8A, 8B, or an 8C depending on where which part of the country you're working.
Manong knows best.
There's no such thing as a pathway, unfortunately, for any specialism actually. So I became a DSN just because I was interested in diabetes, and whilst I was in post, I was studying as well. So I think the thing is that if you want to if you're interested in a subject in an area, I would suggest that you read about it. You don't have to study yet, but you look for opportunities because most opportunities for specialism are there. You don't have to have the qualification fully as such, but as long as you're willing to undertake the study whilst you're in post, you can get there. So in my case, I was, for example, I started as a staff nurse in acute admission unit, and after a year or two, I became a charge nurse And then there was an opportunity for community matrons at that time, around about 2005. This is before you, Philip, before you came here. So we have, I think there was a white paper about care closer to home. So they had community matrons in post around about 2005. And I applied for that as a band seven. And I met all these specialist nurses, of course, because as a community matron, you manage the whole caseload, not just diabetes, but long-term conditions. I saw one of the specialist nurses in diabetes, and I said, I want to specialize. What do I need to do? They said, oh, we have an opening for a band seven specialist nurse. Are you interested? So I did. I applied and I got it. And then after that, I continued my studies. Of course, I did the modules on diabetes at the university, the local university. I've done my prescribing in 2005, 2006 as well. So I completed my postgraduate diploma a few years later because I can't, nobody, I think, because we're here to work, aren't we, Philip? So we can't just study full time. So you need to, when you do your education, university level, you have to do it part time. So you can do it over 6 years. So I've done all of that. I've done my research as well, and I finished my postgraduate diploma in 2009, if I remember. And I've just completed my master's in leadership recently as well. So don't stop learning in a way because opportunities are there. These are free opportunities in the NHS. So you're not going to pay anything.
It's free, right?
As long as you include that in your appraisal, that I want to study more, I want to learn more, and that the trust will support you. So all of these are there for us to be able to take as opportunities, really.
Manong knows best.
Don't worry if you don't know everything about diabetes or any specialism you want to go into. I think you're never going to learn everything anyway. You're going to learn most, but nobody knows everything about anything. So things are changing. What might be relevant 10 years ago, for example, may not be relevant now. So you need to make sure that you keep updating yourself. This is where you need to maybe allocate a few hours of your week reading and reading and reading again. So learning is never ending.
Always remember, Manong knows.
Manong knows best. Put your worries to rest when staying in the United Kingdom. Manong knows best.